Hi there, my name is Jannat Malik, and my topic for presentation is Incidence and Predictors of In-Hospital Mortality among Diabetics Undergoing TAVR. Firstly, a little bit of background. Aortic stenosis is one of the most common valvulopathies in the world, and around 61% of all valvular deaths are attributed to aortic valve disease. The incidence and prevalence of aortic stenosis increases with age. Both aortic stenosis and diabetes are progressive diseases that carry significant morbidity and mortality. Mild asymptomatic aortic stenosis can be treated conservatively. However, severe aortic stenosis and symptomatic aortic stenosis should be managed with aortic valve replacement. We studied using an observational cross-sectional study using the nationwide inpatient sample and included 33,325 adult patients with aortic stenosis who underwent TAVR. The goals of the study were to delineate the differences between comorbidities, demographics, and hospital outcomes among diabetic and non-diabetic patients. Therefore, the group was divided into non-diabetics and diabetic patients. We found that the mortality was higher among patients with diabetes who underwent TAVR and had comorbid diseases such as fluid and electrolyte disorders and stroke. However, in-hospital mortality was lower among diabetics compared to non-diabetic patients with aortic stenosis who underwent TAVR. Therefore, we concluded that TAVR is a preferred modality in patients with aortic stenosis and diabetes, along with cardiovascular risk modification, strict glycemic control, and timely renal follow-up. Thank you.